This is KTVO's Good Morning Heartland.
And welcome back. It is 6:23, and as you know, October is Breast Cancer Awareness Month, and for many of us out there, we've been affected by it one way or another. This morning, we have Dr. Margaret Wilson, DO and Dean of A.T. Still University's Kirksville College of Osteopathic Medicine, to talk more about breast cancer. How are you doing?
Good morning.
And so as we know that this is the leading cause of death for women.
It's actually the leading cause of cancer in women. Luckily, the deaths for breast cancer are actually going down, probably due to increased awareness. That's why this month is so important to educate women.
And although it's very uncommon, breast cancer can actually affect men as well, correct?
Correct. Certainly women have a much higher risk of breast cancer, but we're seeing more incidents of breast cancer in men, so it is important for them to pay attention to.
And what should women look out for when either they're screening themselves or going to a doctor and possibly maybe even asking questions?
Well, I think some important things first is to be aware of your own body and make sure that you notice any changes. Things to watch for might be a change in breast tissue like a lump, or skin changes are important to look for. Changes in the nipple or discharge. So any change would be something important to make sure that they see their doctor.
And are there any other symptoms that maybe a woman should look out for?
Those would be the most common. Unfortunately, breast cancer often isn't detected by any signs or symptoms. That's why screening and prevention is so important.
And you just touched base on screening and prevention. What types of screening and testing are available for women?
Well, certainly mammogram is the most common type of breast cancer screening that's used routinely. There are other radiological tests that can be done to help with mammography. Things like ultrasound, MRI is sometimes used in higher risk women or in uncertain results from mammogram. But mammogram is the most common, and it's really important to see your doctor, get a breast exam, and talk to them about mammogram screening.
And I know over the years the age has changed. So at what age should a woman start, paying attention and, going for the testing?
Well, I think it's important to pay attention and be educated, certainly at an early age, starting in your 20s. In terms of mammogram screening, there's a lot of controversy these days about when that should start. I think all the experts agree that it's important to have regular mammograms, but the age at which you start can be a little bit not agreed upon with the experts. Certainly after the age of 50, it's important to get regular mammograms. The controversy kind of comes between the age of 40 and 50, how often. And that's important to talk to with your doctor to see, what your risks are, what your personal risk and family history may be, and how often you ought to get it.
Okay, well, thank you so much for your time. I appreciate it. And we'll post all this information on our website at heartlandconnection.com.